Hello and welcome to Medical Dialogues, your daily dose of health and medical news. I'm Roshni Dhar. Let's look at today's top headlines. Every medical college must have Department of Integrative Medicine Research, and MC calls for integration of modern medicine and AYUSH. In order to promote integration of modern medicine with homeopathy and Indian systems of medicines including Ayurveda, the National Medical Commission has made it mandatory for all medical colleges to have a Department of Integrative Medicine Research. The decision in this regard was taken at the first joint meeting of NMC with the functionaries of the National Commission for Homeopathy and National Commission of Indian Systems of Medicine. While the meeting was conducted on 29 June, Kannur-based ophthalmologist and RTI activist Dr. K.V. Babu obtained this information by filing a RTI query. Apart from this, the recent changes in the MBBS curriculum, including the mandatory yoga practice, was also raised in the NMC meeting. As for the latest media reports, the chairman of NMC, Suresh Chandra Sharma, revealed in the RTI reply that the meeting discussed the best methods and scientific manners for integrating the modern medicine with homeopathy and Indian medicine systems to develop all the three sectors. In this regard, he further mentioned that the integration process should help people to prevent, cure and control diseases. Referring to the mandatory 10 days yoga practice for the MBBS students and faculties, President of the UG Medical Education Board of NMC, Dr. Aruna V. Vanikar, informed that this new yoga curriculum would commence on 10th of June every year and conclude on the International Day of Yoga. MBBS, BDS and NTRUHS this year fee structure. Through a recent notification, Andhra Pradesh-based Dr. NTR University of Health Sciences has released the fee structure of MBBS and BDS courses for the academic year 2022 and 23. The Andhra Pradesh government fixed the MBBS and BDS fees for the medical colleges in Andhra Pradesh on the basis of the fee structure recommended by Andhra Pradesh Higher Education Regulatory Monitoring Commission. Referring to this, the State Health Department mentioned in the notice, in exercise of the powers conferred under Section 7 of Andhra Pradesh Educational Institutions Act 1983, the government considered the fee structure recommended by the APHERMC in their meeting held on 28 October 2020, determining the fee structure per annum for the UG medical and dental courses in private, unaided, non-minority and minority colleges in the state of Andhra Pradesh for the block period of 2020 to 21 to 2022 to the year of 2023. The fee structure suggested by APHERMC back in 2020 will remain applicable for the academic year 2022 and 2023 as well. In this regard, the government notification read that on careful consideration, the government of Andhra Pradesh hereby notify the fee structure for the undergraduate medical and dental courses in private, unaided, non-minority and minority colleges in the state of Andhra Pradesh. The details of fee structure on the colleges are at Annexure 1 and Annexure 2 to this order respectively. For more details, you can check medicaldialogues.in. Patanjali told to remove misleading advertisements from media. The State Licensing Authority, Ayurveda and Unani Services, Uttarakhand, as well as the Central Consumer Protection Authority have taken a firm view on 5 advertisements placed by Patanjali Ayurveda that promise to treat blood pressure, diabetes, goiter, high lipid levels and glaucoma. The products are BP Grid, Madhu Grid, Thyro Grid, Lipidome Eye Grid tablets. The SLA asked Divya Pharmacy, the marketing arm of Patanjali Ayurveda, on 7th of September to remove the advertisements from the media and submit an explanation within a week. This is based on complaints by Kannur-based ophthalmologist K.V. Babu. Divya Pharmacy had told the government authorities in May this year that it would stop releasing advertisements on its products that promised to treat heart and liver disorders. This was also based on another complaint filed by Dr. Babu in February. The Union AYUSH Ministry too had pointed out in March that the ads on Lipidome, Levogrit and Levamrit had violated provisions of the country's drug laws. New COVID-like virus found in bats could affect humans resist vaccines, according to a study. A new SARS-CoV-2-like virus discovered in Russian bats is capable of infecting humans and is resistant to current vaccines against COVID-19, a study has found. A team led by researchers at Washington State University found spike proteins from the bat virus named COSPA2 can infect human cells and is resistant to both the antibody therapies and blood serum from people vaccinated for SARS-CoV-2. A virus uses the spike protein to enter and infect the human cells. Both COSTA-2 and SARS-CoV-2 belong to the same subcategory of coronaviruses known as sarbecoviruses. The findings published in the journal PLOS Pathogens highlights the need to develop universal vaccines to protect against sarbecoviruses in general rather than just against known variants of SARS-CoV-2. The researchers said that right now there are groups trying to come up with a vaccine that does not just protect against the next variant of SARS-2 but actually protects us against the sarbecoviruses in general. The researchers determined COSTA-1 posed low risk to humans, but COSTA-2 demonstrated some troubling traits. The team then set out to determine if current vaccines protect against the new virus using blood serum derived from people vaccinated for COVID-19. The researchers found that COSTA-2 was not neutralized by current vaccines. They also tested serum from people who were infected with the Omicron variant, but the antibodies too were ineffective. Researchers said that the new virus is lacking some of the genes believed to be involved in pathogenesis in humans. There is a risk, however, of COSTA-2 recombining with a second virus like SARS-CoV-2. Researchers further added that when you see SARS-2 as this ability to spill back from humans and into wildlife, and then there are other viruses like COSTA-2 waiting in those animals with these properties we really don't want them to have, it sets up this scenario where you can keep rolling the dice until they combine to make a potentially riskier virus. It sets up this scenario where you keep rolling the dice until they combine to make a potentially riskier virus. That's all from the health world. Now we have Mr. Zaman to update us about the happenings in the medical world.
I'm Mr. Zaman and here's what I bring to you all from the world of medicine. Stressed people tend to focus more on their romantic partner's negative behavior. Stressful life circumstances can affect how married couples interact, but can they affect how partners see each other? A person experiencing stress is more likely to notice their spouse's negative behavior than positive, according to a new study published in Social, Psychological and Personality Science. Researchers asked 79 heterosexual newlywed couples to complete a short survey each night for 10 days, in which they documented both their own and their partner's behavior. Before beginning this portion of the study, participants completed a questionnaire in which they shared details on stressful events in their life. Studying newlyweds drives home the significance of the results because couples are especially likely to focus on each other's positive behavior and overlook the negative actions during the honeymoon period. Researchers noted a single stressful day was not enough to make someone zero in on their partner's negative behavior, but a longer accumulation of stressful life circumstances could cause this shift in focus. The findings also suggest that those under stress were not any less likely to notice their partner's positive behavior, but they were more likely to notice inconsiderate actions. While it's possible that being aware of the effects of stress could allow couples to correct their behavior and limit harm to the relationship, Dr. Neff, who is a study author, notes that this will remain in speculation until it is studied further. She also says that future research would do well to expand the study beyond the honeymoon phase. Anxiety during pregnancy may cause earlier births, according to study. Women who experience anxiety about their pregnancies give birth earlier on average than those who don't, according to research published by the American Psychological Association. The study, which examined the relationship between pregnancy length and different measures of anxiety, could help doctors understand when and how best to screen for anxiety during pregnancy to help prevent preterm birth. Previous research has found that up to 1 in 4 pregnant women has clinically elevated anxiety symptoms, and that anxiety can be a risk factor for preterm birth or birth before 37 weeks of pregnancy. However, those studies have used a variety of measures of anxiety and have looked at both general anxiety and pregnancy-specific anxiety, which includes worries about childbirth, parenting, and the baby's health. Researchers have also measured anxiety at different points in pregnancy from early to late pregnancy and most often in the second trimester. To sort out these various effects of timing and anxiety type, the researchers examined data from a diverse sample of 196 pregnant women in Denver and Los Angeles who took part in the Healthy Babies Before Birth study. The researchers found that participants' scores on all three scales of pregnancy-related anxiety were interrelated, suggesting that the scales measure the same underlying thing. They also found that pregnancy-related anxiety in the third trimester was most strongly associated with earlier births. Rodents are pools for life-threatening disease according to study. Fungal diseases in the human population are on the rise, so it's important for health authorities to understand where these pathogens come from. A new study has searched for fungi in the lung tissues of small mammals and found fungal pathogens that cause diseases in humans. This suggests that these rodents can serve as reservoirs, agents of dispersal, and incubators of emerging fungal pathogens. Our analysis was specifically focused on lung pathogens that cause disease in humans, detected a wide range of fungi in the lung tissues of small mammals, said Paris Salazar-Ham, first author of this research of the University of New Mexico. Over the last 4 decades, there has been an increase in reports of novel human pathogens like the virus COVID-19. Host jumps have also allowed fungi to evolve and diversify. In some cases, this could increase their virulence and in turn have an impact on humans. Using next-generation sequencing, a method that allows a quick assessment of the wide-ranging species of fungi, the researchers analyzed fungal DNA in rodent lung tissues from museum specimens. We detected the fungus coccidioids, the cause of valley fever in the lung tissues of animals from Kern County, California, and Cochise and Maricopa counties in Arizona, areas that have high rates of this disease, reported the author. In addition, we detected sequences from coccidioids in animals from Catron Sierra and Socorro counties in New Mexico, which is the first time this pathogen has been detected in the environment in the region. Bladder cancer and its declining awareness. Cancers are on a rise in India, and bladder cancer is the 9th most common and leading cause of cancer in the country. However, in few countries like Europe, it is the 5th most common cancer and affecting over 2 lakh people every year. It is caused by changes to the cells of the bladder and is often linked with exposure to certain chemicals. Smoking, for example, has been identified as the single biggest risk factor for bladder cancer. Common symptoms are usually related to urine and include blood in urine, changes in the color of urine, pain when urinating, frequent urination, and more. A change in the color of urine or blood in urine is usually the first sign of bladder cancer and should prompt an immediate visit to a doctor or healthcare professional. However, over half of those surveyed did not know that a change in the color of their urine could be an early identification of bladder cancer. An early diagnosis of bladder cancer can significantly improve the treatment outcomes. One of the most common first indicators of bladder cancer is the presence of blood in urine. According to the survey, 75% of adults are not always checking their urine for a change in color, with 22% rarely or never checking their urine. The new survey has also shown that adults are unwilling to seek medical advice, even if they did notice symptoms. 20% of participants said that they would wait 1 week or longer before speaking to a doctor or healthcare professional if they noticed a change in the color of their urine from yellow to orange, pink or red. The most common reason for not seeking medical advice was that people expected it to improve by itself. That's all from the medical world. Now we have Dr. Nandita Mohan to update us from the medical journals.
Hello and welcome to Medical Dialogues Journal Club. I am Dr. Nandita Mohan and I have a recent research to share with you all today. The study published in the Journal of Postgraduate Medicine, Education and Research PGI-MER sheds light on the most important causes of neonatal mortality in India. Now in our country, the biggest question posing is managing neonates and children in the need of positive pressure ventilation with manual ventilation are not an uncommon practice. That is basically due to the lack of adequate resources, but it's basically due to the lack of data on the outcome of manually ventilated neonates. Now, this study was conducted to determine the short-term outcome of manually ventilated outborn neonates admitted in a pediatric emergency of tertiary care hospital in northern India. The retrospective study was conducted involving close to 131 outborn neonates who were manually ventilated with self-inflating bags. The details regarding their demographic variables, the perinatal period, treatment received, ventilation, the reason for intubation and positive pressure ventilation, the duration of intubation, the complications related to positive pressure ventilation, diagnosis, and final outcomes were all the factors that were noted. The mean age of neonates was around 5 days and 76% of them were males. The common diagnoses were hypoxic ischemic encephalopathy, early onset neonatal sepsis, late onset neonatal sepsis, and hyaline membrane disease. The survival rate was accounted for approximately 22.1%, and 45.8% of the cases even died, and 32.1% left against medical advice. So in conclusion, it was said that 1/5 of manually ventilated outborn neonates did survive. Complications related to their positive pressure ventilation and pressure of shock and hypoxic ischemic encephalopathy were an independent predictor of poor outcome. Therefore, the facilities for the care of outborn neonates need definitely to be an upgraded system, but in the setting where these facilities are not available, the provision of manual ventilation may save a significant number of babies. How day-to-day habits in one's life can actually influence their health as well as the awareness of nutritional status and habits greatly affects and has an effect in reducing the prevalence of hypertension. Now, a recent study published in the Indian Heart Journal highlights the fact that there is a rapid economic growth. Also, the demographic transition as well as the changes in the lifestyle and dietary habits, the prevalence of chronic non-communicable diseases are increasing globally. Now, this nutrition transition has accompanied a rise in the prevalence of overweight and obesity, specifically in a country like ours. We all know that along with cardiac diseases, hypertension also contributes itself as the leading cause of death throughout the world. The present study was conducted to assess the prevalence, determinants and knowledge as well as its practices about hypertension among rural adults in India. A community-based cross-sectional study was conducted out in 10 major states of the country. Information on socio-economic demographic particulars was collected, and the anthropometric measurements like height, weight, waist, hip circumference as well as the blood pressure were all measured. Foods and nutrient intakes were assessed by 24-hour recall method. The results of the study showed that the prevalence of pre-hypertension was 45.3% and hypertension was 22%, while overweight obesity was 22.6%. It was also found that the prevalence of hypertension was found to be higher in West Bengal and Kerala and low in Madhya Pradesh and Uttar Pradesh. While the odds of hypertension was 1.2 times higher among forward communities, businessmen, tobacco users and those consuming alcohol, 2 to 3 times higher among overweight and obese as well. About 76% were aware of hypertension, 21% were old hypertensive patients, while 19% were on treatment. So keeping all these factors, all these results in the mind, the researchers concluded that age-standardized prevalence of hypertension was 20% among adults and was associated with age, occupation, overweight obesity, tobacco and alcohol use, low intake of carbohydrates and zinc. Therefore, increasing awareness as well as the consumption of healthy diet through behavior change communication will definitely help to control hypertension among adults.
Never miss a medical update from Medical Dialogues. Like, subscribe, and press the bell icon.